Okay, we're going to go ahead and get started. My name is Chelsea. I'm the Director of Outreach here at MADVoters. We are a social advocacy organization focused on legislative education, voter outreach, and candidate support. And tonight we have a couple of our MVP candidates with us, and we are going to be talking about healthcare affordability and accessibility. And both of our panelists have some experiences with this accessibility in healthcare. And we're very interested to hear from you guys. And I'm going to go ahead and Leslie, please introduce yourself. Let us know about your campaign and your personal and professional connection to this topic.
Okay, thank you for having us and all on here. My name is Leslie Nuss Bamsberger, and I'm running for Indiana State Senate in District 5, which is half of Porter County, the southern half. It's half of Jasper County, the eastern half, all of Pulaski, and all of White County. And I'm really excited to run this campaign because so many of my platform issues really are tied to healthcare and accessibility and affordability. One of the things that I'm tied to this issue is I have a child with multiple disabilities. His name's Harry. Going to be 16 next month. He has Down syndrome, but he also had a stroke when he was born. So he has right hemiplegia that may have caused him to have epilepsy, and he also has autism. So he's nonverbal and he has weakness on his right side. And after having him, we had to go more into the healthcare system. So that's part of it. But then I also started advocating for the community, that the special needs community, which I've been doing for about 15 years. And I realized just how much help we all need, and that there are a lot of people who just cannot advocate for themselves, and they miss out on services, and or the system is not really serving them. And I personally believe that the mark of an advanced civilization is one that cares for all people, and including the most vulnerable. So that's really near and dear to my heart. And earlier, before this started, we were talking about mental health, which I'm incredibly interested in. I also do music at a school 1 day a week, and some of the students in there have like learning or emotional disabilities. And mental health is just so important because we want these kids to be fully functioning in our culture and be able to have jobs and families and houses and all the things that we want people to have. And then just for that, I would say reproductive rights and maternal care is super big with me also. And that's another reason why I'm actually sitting here, is because I had a miscarriage after my two children were born, and I could have easily died. I was bleeding quite heavily, and I realized just how things can go wrong so quickly, and that we don't need women to be afraid to seek the help that they need. And that's just my piece of it. But I do believe in reproductive rights for all, for any woman. And I think that it's incredibly important. I just thank you for giving me the opportunity to be here. Thanks.
Thank you so much, Leslie. And yeah, we're in a space of advocacy. We really see where policy plays a part in that, and who is writing that policy really matters.
Yeah. It
Before
does.
I have Katie introduce herself, I do want to welcome Senator Qaddoura to the call. We are doing some introductions right now. I'm going to have Katie go ahead, and then Senator, we'll hear from you.
Absolutely. Thank you.
And Katie, please let us know about who you are, about your campaign, and your connection to this topic.
Okay. Yeah, hi. Yeah, I'm Katie Morgan. Again, thank you for having me. I'm excited to be here. I am running for Clark County Commissioner, so I'm down in the southern part of the state, right across the river from Louisville, Kentucky. So we do have access to a few more resources than maybe some of the more rural areas of the state. But that also means we have to cross the river. And if you are using Medicaid, you don't have those options. So that is a huge issue that I can see. My connection to this, I've actually got several different connections with this. I actually have three special needs children. They're all three grown. My youngest has autism, and my two oldest actually have mental health issues, most specifically bipolar and borderline personality. So it's been very difficult trying to find the right resources to make sure that they were covered and taken care of. They are all older now, and because I now have a little more free time, I apparently am a glutton for punishment and decided to start advocating for people, the most vulnerable populations as well. I started a nonprofit called Vulnerable Adult Care Advocates, and we actually help the elderly with dementia or other incapacitated adults if they don't have family members that are able to help them with their healthcare and financial decisions through low cost guardianships. And so by doing that, I have witnessed several times where many of my clients have not been able to get the particular resources they need when it came to either their mental health or when it came to proper care for their dementia, especially when it comes to something like Huntington's disease that seems to be extremely difficult to find any treatment for it in Indiana. I've actually had to ship some people to Cincinnati for them to get proper care. And I just feel like that's ridiculous. I think that we should be doing a better job to protect our Hoosiers.
Absolutely. Thank you so much, Katie. And Senator Qaddoura, please introduce yourself, your campaign, and your personal or professional connection to this topic of healthcare accessibility and affordability.
Thank you. I appreciate you and esteemed colleagues on the panel and those who are attending. My name is Fady Qaddoura, and I have the honor of serving in Indiana State Senate District 30, which is the north side of Indianapolis. And I'm the incumbent for the same district. The connection with healthcare is personal and is deep. I think all of us, through different stages of our lives, we get impacted, whether personally or a loved one. Sometimes some of us go through unfortunately tragic experiences that impact our passion towards the causes that we deeply care about. And as it relates to healthcare, I personally had several life experiences that were critical in shaping my understanding of the importance of affordable healthcare that should be made accessible. Most recently, as one of my esteemed colleagues mentioned, the issue of reproductive rights in the state of Indiana, which I firmly believe does not only impact 50% of the population, but rather 100% of the population. But on a personal level, when I was younger, my parents were poor. They did not have health insurance. And as such, they did not take care of themselves to the point that they should. And we, as kids, as we grew up, we had difficulty accessing the healthcare system to get the immunizations that we need on time and the proper care. We are fortunate and privileged to be healthy now. But I was homeless after Hurricane Katrina. And my oldest daughter was only 3 weeks old when the hurricane impacted the city of New Orleans, where I used to live. My wife needed medical attention and my daughter needed medical attention. And that was an extreme critical experience in our lives where we knew the importance of having accessibility to a system that can provide the services when you need it in an affordable manner and with the highest care. I also had a niece who was 4 years old. Unfortunately, she passed away in 2017. She had a stage 4 neuroblastoma. And through her personal life experiences, and we witnessed personally the impact of having a family member who had an extremely chronic, and in that case, unfortunately, was a terminal illness, which took her life away. The cost that comes with that, the traveling the nation trying to find a cure, having health insurance plans that even cover anything that is remotely available to help her manage her conditions at that time. And then finally, even before I got elected, but more recently after I got elected, there are many friends and neighbors in my community, in my district, who struggled because of the issue of affordability. Unfortunately, we live in a state that is considered one of the most expensive healthcare states in the nation. And the accessibility is an extreme problem, especially in rural communities and communities where some families have to drive for almost an hour to access a specialized physician in certain spaces or areas. And that causes many families who can't afford healthcare to either neglect their health or be unable to provide for themselves the services that they need, or in many instances, such as recent as last week, constituents and neighbors who end up receiving services that they can't even afford to pay the deductibles and the out-of-pocket expenses and medical debt that chases them for the rest of their lives, impacts their credit scores, impact their housing options because they might lose their homes, they might be foreclosed by their banks, and so on. So it's critical at every level. Every human needs health care. And I firmly believe that healthcare is a human right that should be offered to all citizens in the most affordable and accessible way to be sure that we take care of our communities.
Absolutely. And that is almost like a black hole, too, when you're stuck in this medical accessibility nightmare. On top of that, it's affecting your mental health. And then you can't get mental health services. And so we're stuck in just this loop, and we need to get out of that. And Indiana is suffering horribly right now. So we recently had a $1 billion Medicaid budget shortfall in our state that wreaked a little havoc for our families who are using one of our programs. And I would love to hear from you guys if you guys have any information you'd like to share, how you think this is going to be affecting Hoosiers, and what you think maybe we can do, how we can advocate for ourselves in this space.
Sure.
Go ahead.
I would think that Senator Qaddoura would be able to explain a little bit more about it, exactly what happened. But there was this $1 billion shortfall. So they decided to cut the attended care program. And that was so that families who cared for the most medically fragile children and sometimes adults who they had to stay home and care for them would get paid so that they wouldn't fall into poverty. And it's a program that worked and that people were really very grateful for. And I just know that because of the children that I know and the people that I know, that many of them are struggling and we don't need to make it worse for them. And when they have $1 billion shortfall, why do they have to go for the most vulnerable? Why can't they work out something? I know I like to hear Senator what he has to say about that. But yeah, I just know how hard it is to care for my son, and he's not in a wheelchair, but there are children who are in wheelchairs who have feeding tubes. They can't do anything for themselves. And it is so hard to care for them. I can definitely tell you that. And these families need help. They don't need to be hurt.
Yeah. And especially the people like to look at it like people were just trying to get rich and not actually doing a job by staying at home and taking care of their medically fragile loved one, whether adult or child. The truth is, they were getting paid $14 an hour, which we all know is not really enough to really get by. There was always somebody else probably still working in the household as well. And it's a lot of work. It's not like they're sitting there watching TV all day. They are putting in a lot of man hours to take care of this person. So they do deserve to get paid for that.
I appreciate, Chelsea, you bringing this topic. In December of 2020, unfortunately, the Medicaid agency reported there was a forecasting error to the tune of 1 billion. And it was a data error that basically was caused by delayed claims that were processed, as Medicaid claims take a while before they are processed. And giving what was going on through COVID and the analysis of that data basically showed that delayed forecast. Now, in December of 2023, in a budget committee, when before any of these issues were formally announced, we received the news on the budget committee, which I serve on, that there is about $700+ million of surplus in Medicaid. So I made a motion in the committee to move the 700 million to the Medicaid Reserve Fund in case there's a shortfall in the future in Medicaid, so that we can cover that. Unfortunately, at that time, the committee was short-sighted and did not move the money into the Medicaid Reserve Fund, but rather they moved it to the general fund of the state of Indiana.
Wow.
And unfortunately, later, as we started working on this issue, we were successful in pushing the state General Assembly to deal with this issue. And they ended up moving back at least $700 million to the Medicaid to deal with this problem, but they never addressed the underlying structural issue of the problem. In 2022, I successfully passed a piece of legislation, Senate Bill 438, which took care of the home health issue for many of the children who have complicated healthcare conditions. And many of those live also in the central Indiana region, and some of them in my district. I know their families, I've visited with them, and they do attend our local school system. And we're talking about some of these very complicated health conditions. Unfortunately, one of those who was with me at the state of Indiana when the governor signed the law that passed to deal with home health just passed away this past Friday. She was 15 years old. And those families, similar to what Katie might have described, but those families are amazing, dedicated, hardworking, day in, day out. They pour love and compassion and they work tirelessly to serve their children. What happened during the COVID pandemic, when what many of these children, one, were not able to go to school because schools were closed. And two, the home health agencies that should have provided pediatric healthcare services or nursing specialized healthcare professionals, they struggled with finding healthcare professionals to employ. So we had a workforce crisis. So my legislation tried to resolve the healthcare crisis by increasing the pay for parents so that they can do some of the work that these healthcare professionals were not able to do. Not to fully replace the healthcare professionals, but take on some more of that responsibility and get paid for it. In my district, there's a family where the one of the spouses had to leave their job completely so that he can stay home, and the mom was or became the breadwinner so that they can take care of their child. So this crisis is real. It is impacting real families across the state. It is hitting hard across the state where families need to provide adequate support for their children. And in my view, the state of Indiana completely and miserably failed in serving these children. And they wanted to resolve that $1 billion problem on the backs of the backs and the shoulders of these families and their children, and the long-term care facilities and programs that impact what we call the long-term in-home options or choice programs for senior citizens to age in place. So they started cutting services and restructuring it. To conclude, we are still applying pressure on the agency to enhance communication with parents, to be sure to tweak the program so that families are served to the best of the state's ability, to be sure that the structured family care, which is the new program that they came up with all of the jumps and hoops in it, whether to get prior authorization hours or to do different things, are streamlined so that families can get the care that they deserve for their children and they can get compensated for the hours that they work. So I know it's a complicated problem. It is $1 billion problem, but I've witnessed the state spending more than $1 billion on less important issues, including renovation of facilities that could have been delayed to the tune of 1.2 billion. So which one is more important? Investing in capital and renovating buildings or taking care of our kids when they desperately need these services? So there's a misplaced priority by the state of Indiana from a fiscal perspective in terms of serving these families.
Absolutely. And I want to remind everybody on the call who might be listening or might be listening to our recording at a later time, you can look into legislation. You can read the legislation that is being put forward, the legislation that is being voted on, and you can see the legislators that are writing legislation that is going to help you and your family access health care, maintain the affordability so you don't lose your home. And you have to vote those people in order to get that legislation. Thank you guys so much for sharing some more of those like personal stories. We need other Hoosiers who aren't experiencing this to understand that other people are and how that's going to affect them. So thank you so much for that. Talking about advocating for disabled, elderly, and medically complex Hoosiers, it's really important to improve the equity and infrastructure in this. Where has the state shown success and where do we need to make improvements? And anybody is welcome to answer this if you have a opinion on it.
I'm having a little bit of a hard time finding so many successes, to be honest. Listen, that's my main problem. I'm trying to come up with a positive first. But truth is, there are a lot of shortfalls and they failed a lot in a lot of different ways. Like with my career, since mostly what I do is adult guardianships for mostly the elderly, we have a lack of understanding what guardianship is in the state. I've had that. I've had to come up against and fight against doctors that didn't even have any idea that I'm actually the legal person that is supposed to make the decisions. But there's also a problem with pay because there's not a lot of people that want to be guardians unless they can do it for someone that has a lot of money. Because if a person has Medicaid in the state of Indiana, we are only allowed to charge $35 a month for our services. And even though it has gone time and time again to try to increase it to just something like $100 a month, nothing exorbitant. It's a lot of work. There's a lot of documentation. We take them to doctor's appointments. We have to handle them when we have to go to the bank or attorney's offices, all these different things. And $35 a month doesn't cover it. So that's again why I started mine as a nonprofit, so I can use grant funds to try to help people that don't have that kind of money, because otherwise you're just on your own and you got nobody.
Very real words, few and far between successes in the last couple decades.
I will share a couple of successes, and I hope that this is a message of hope of the power of organizing and mobilizing constituents across the state of Indiana. In the last 2 years, for the last couple of decades, at least on the Democrat side, we have been calling for investments, healthcare, preventative healthcare, expanding affordability, accessibility, and investing in mental health. We should destigmatize mental health and be sure that we expand services across the state. A recent report, Behavioral Health Commission, that was created, mentioned or listed that the economic damage to the state of Indiana, or the cost because of untreated mental health illnesses, exceeded $4 billion annually. So over the last few years, there were several organizations that came together, especially organizations such as Faith in Indiana and the Black Church Coalition and MADVoters and others, who came together across the state and fiercely advocated for expanding support for mental health and supporting the newly created 988 system in the state of Indiana. And I think at that time we were hopeful to get more than $300 million to sustain the system and to also expand the mental health service delivery model to what we call the certified behavioral health community centers. And after 2 years of hard work, in 2023, we were successful in passing the legislation that provided the infrastructure for mental health for both the 988 system and the behavioral health, the certified behavioral health community centers, with $200+ million in appropriations. Now, I'm just saying it here today, and it might come across as, oh, that was easy. They just got a law passed with some dollars to support it. It took years of organizing, years of mobilizing, years of building coalitions and alliances across the board. Democrats, Republicans, and independents. We said that healthcare is not a political issue and should not be politicized. It is one of the basic responsibilities for the state. This, after that legislation passed, it took also 2 years after the pandemic began in 2021 to fight for expanding public health investments across the state. So in 2020, for those who are watching or interested, the School of Public Health at Indiana University published a report, and I recall the title of it as the Healthcare Drivers in the State of Indiana. And they did a very comprehensive study where they outlined the challenges for why Indiana is not a healthy state. And among those challenges, there were more than 15 issues that were laid out that I highly recommend for everyone to read at least the executive summary of that report to understand the challenges in our state. But among those issues was the lack of investment per capita for preventive public health. And that again pushed us to advocate fiercely to expand public health funding. We were successful. We created a statewide fund for a partnership between the state of Indiana local public health agencies it was an opt-in model by which local county departments of health had to opt in to receive these grant dollars to expand services on a local level. That legislation did not provide everything that we have fought for, and it was only the first step. It was only the first step in a very major investment that we needed to do as a state. Again, that report is called Addressing Factors That Affect Healthcare Costs, recommendations for Indiana stakeholders. And I believe it was published in 2020 by the Fairbanks School of Public Health at IU in Indianapolis. So again, not to repeat this, but the point is that investing in preventative services, for every dollar that we prevent upfront, we could save hundreds of dollars in services that are on demand for Hoosiers who might become ill or impacted if they don't receive the preventative services upfront. So to conclude, if you look at the entire healthcare system scope and from a macro level, looking at mental health, looking at reproductive health, looking at affordability and accessibility, looking at where we rank in terms of cost and access across the state, we are in the bottom 5 healthcare states in the country when you combine all of these issues together. And if you start looking at some specialty areas, such as having OBGYNs or looking at mental health psychiatrists and so on, the problem becomes even more complicated. So I not only I urge folks to read the report, but if you wanted to understand why does the state of Indiana doesn't move forward with healthcare, we have to understand the politics of what happens at the state house and the competing interest groups that push against these reforms, from the insurance industry to the hospital industry. And then you have to look at who is in control. And currently we have a majority within one party that controls the Senate and the House. So the question becomes, if you have control of the governor's office, the House and the Senate, why are you unable to move forward with making significant reforms to lower healthcare costs in the state of Indiana? So these are critical questions that I think every citizen should hold their elected official accountable to say, under your watch, since you have been elected, what have you done on the space or the issue of healthcare? And how much of investments did you bring? And what solutions did you bring to the table? And what legislation did you introduce and work on?
Yeah, I have to say, I completely agree with that. Actually, us on the statewide level, a bunch of us Guardians has started the Guardian Association of Indiana so that we can start trying to lobby healthcare decisions and try to help out with things. Yeah, he's exactly right. The power of organizing does make a huge difference. We're just now getting started, so we haven't seen a lot of improvement yet, but we've got our fingers crossed.
Absolutely. It really the importance of legislation. Again, voting records are public. You can see where these legislators have voted, how they have voted, and then you have to hold them accountable. Leslie, please. Oh, you have to unmute real quick.
Sorry. Thanks. Yeah. It's so hard. You asked for some positive things too. So I was thinking it's really not ideal, but I am grateful that we do have Medicaid, the Medicaid waiver for children with disabilities. And when my son was born, the process was really hard and the waiting list was multiple years. Like people would say, you're supposed to put him on the day he's born and you're going to be waiting years because many kids with disabilities have high health costs. So it did take us several years, and to get more people on the rolls, they cut the amount of services that you could get just besides Medicaid health. So they cut that in half. So that was a negative thing, but on the plus side, more people were able to get on. And I do know that it's very appreciated by the families who use it. However, from being at my son's school, I found out that there are many families who have never even signed up to be on the Medicaid waiver. And I and other people have been trying to reach these people and get them to sign up because we can see that their children would benefit from more services. So some of that is like we're talking about public health, just education and helping them, showing them how to fill out the forms that these services are available. Another thing is when my son was born and we first got on the waiver, we couldn't go to Chicago. If there was a better doctor in Chicago, we could not leave the state for the healthcare. And they can do that now. So I think that is good. But yeah, there's so many improvements and that could be made. Just accessibility. I wish that there were more clinics everywhere that people could walk into, especially people that didn't have health insurance. And I think that would make a great difference. We're talking about preventative health. There are so many people who never go to the doctor. They don't have dental care. They're desperately in need of dental care. And I wish that we could figure out a solution to that. And I'm hoping that it doesn't take years and years. Senator Fady.
It sounds like, coming from everybody, there is a huge need for nonprofits and advocates to fill in the gaps in these spaces. It makes me think of A Better Way and their 988 involvement, and the organizations that are putting vending machines places with access to emergency contraceptive and things like that. Katie, you started a nonprofit to help in this medical space. What are some things that you guys are seeing that you would want to talk about and you would want people to know where people are filling in spaces? This might give people kind of an idea of what maybe they can do in their communities while we're also working to make legislation and policy that helps.
Nonprofits need money. That's a huge thing in with all our issues with current inflation costs and everybody is pinching pennies. It's getting harder and harder because there are so many nonprofits out there that they've now started to compete for funds. Whereas I feel it would be better if we were able to collaborate so we could source our funds together and work together to find solutions. The problem is there's just too many of us right now, and too many people are strapped for cash and can't help. So if you can't give a little bit of a donation to your favorite nonprofit or a nonprofit that you see is filling in a gap, see if they need help, see if they need volunteers. Anything you can do to try to help further their mission will be a huge service.
Absolutely. I can attest to that. There is not a lot of money, especially in the progressive space in Indiana. A lot of our money has been flowing out into states where they have a little bit more hope, unfortunately. And we really need to bring that back in to Indiana if we can.
And unfortunately, a lot of people don't want to, no offense, Senator, but a lot of legislators don't want to send a lot of money toward health and human services. They'd rather spend it on infrastructure, capital, and things like he's talking about with the building. And unfortunately, that's just an unfortunate part of our politics right now. I understand like dealing with the elderly isn't like a sexy topic, but they need our help. They did all these things for us to get us to where we're at. We need to help give back to them.
Thank you, Katie. And thank you again for what you do. I agree. Please volunteer with the organizations, donate if you can, or at least share their pages. Let your friends know that they're out there doing what they're doing. Any free advertising is advertising they don't have to pay for. Big deal. Go ahead, Leslie.
I could say that for people who don't know what to do, join a local group or start one for the thing that's the most interesting to you. When my son was born, some of us got together and started something called Club Wonder. And that was actually really helpful for all of us. We were able to talk to each other, find out about the waiver. We instituted programs in the community. We're support for each other. It doesn't take the place of the other things that we're all working to make better in Indiana. But I think having somebody to talk to is really important. And because we all become so isolated being on our phones and not getting out in the community. But I would say that has been just really good, and volunteering in something to help other people, because then you see the impact more than just healthcare. With my work for my son's school, by being on the PTO, providing activities for the kids to do and that the families can come to, that actually also contributes to better mental health, better integration into the community. So I think part of it, and the more you get involved, then the more you want to do. Then we've got a senator on here, I'm running for office, and so is Katie. So then the more you do, the more you want to get involved to make change. And when you build up those experiences, then you have credibility and you can make positive change. But I would never discount just going up to people, and just if you have an idea and you think of a solution, talking to them, because they really do say all politics is local. Now I see things are much bigger on the state level and there's bigger levers, but it sounds just like a bureaucracy. It does take years to make certain things happen, and we cannot afford to just sit back and wait. So we do have to do all the things that we can do, and yeah, and make the world better that way too.
Absolutely. We all play a part, no matter how small or how big. Some of us are working in policy. Some of us are taking food to our elderly neighbors. It all matters and it all adds up. Absolutely. Would anybody like to add any more to that before we move on? Okay. Thank you guys so much for your input on that. Now, I know some of you guys have a lot of, you've dealt with this, talking about hospital closures and the accessibility issues we're facing. We saw with our abortion ban how quickly we lost OBGYN care. Even places like Planned Parenthood started to struggle not being able to offer as many services. Now I'm going to plug them. Some of them are offering vasectomies. Please let your friends and family know. It takes all of us. Like we said earlier, it affects 100% of Hoosiers. So we're all in this together. So I would love to hear some of your experiences with these hospital closures and the inaccessibility for healthcare.
I'll share from a policy perspective on a very high level. I think in academia, there's a theory that is used in higher level of analysis in healthcare and other market economics. They call it the three sector failure theory. The three sector failure theory, which basically talks about how when one sector fails to provide services, some other sector have to pick up the tab. For example, states alone cannot fund national security. That's why we have the army is funded on a national level and so on, or national defense. When it comes to healthcare, for example, if we have a chronic illness that is taken on the masses and the cost per dose is in the tens of thousands of dollars, and the private sector fails to deliver because it's not affordable, that's normal when government subsidizes the cost of a product so that it becomes a public good to protect the public interest. So that's what the three sector failure theory speaks about, which is when there's a crisis, it basically identifies who's responsible for paying what. And when that sector can't afford it, which other sector should be responsible to take care of the problem? Applying it to hospital closures in the state of Indiana, I think you look at why certain hospitals have a double digit profit margin in some counties, such as Hamilton County, while other hospitals in rural Indiana have to close doors because they can't even afford to pay their staff. And is there a better system, a redistribution of profit system, meaning if a hospital, especially nonprofit hospitals that are created by law, they're supposed to be nonprofit. And by the way, federal and state law does not prohibit a nonprofit hospital from making profit. They can make billions of dollars of profits, but they must reinvest that back into their mission, which is serving people, and not distribute those profits to shareholders. Unfortunately, what we have seen over the last many years is the commercialization of nonprofit hospitals to the point that they have billions of dollars on their cash or their balance sheets, and their executive compensation is in the millions of dollars, and their financial interest became much more a driving force rather than the patient's interest. So those small hospitals in rural Indiana could not find the support needed. In such circumstances, when they can't be profitable enough to just keep their operations going, that's when the state must intervene, because the state redistributes resources, your tax dollars. So when I get the question, why should I care? Because you're paying for it. As a taxpayer, your dollars are collected by the state of Indiana, and you're giving them your consent to divide these resources in whatever way they would like to. So if they are spending the money in ways that doesn't align with your interest, then why are you giving it to them in the first place? You have to be engaged to influence their decisions. So again, I firmly believe that the budgets are the truest reflections of values. If the state of Indiana deeply cared about rural communities, deeply cared about hospitals in our rural areas, then the state should have put money to invest in these areas and came up with laws to redistribute some of the profits for these hospitals to sustain the rural community healthcare needs. I think we have solutions. We have experts in the state who came up with solutions. The report that I mentioned earlier specifically said that there's not a magic bullet. However, there are things that we must work on, such as expanding competition in the state of Indiana, because currently we only have 6 hospital systems that are dominating in a monopoly way, dominating the state's healthcare system. The constant insurance issue, which means they concentrate with certain providers. So the insurance industry is monopolizing the relationship with providers and maximizing insurance profits by negotiating low costs for providers to get reimbursed, but the insurance companies are maximizing their profits because most of them are for profit, and they do redistribute their profits to their shareholders. So we have a problem with the insurance industry. We have a problem with the hospital industry. And then finally, we have a problem with the pharmaceutical industry. These are the three main tenets of the healthcare system, where even providers, when you ask in recent surveys, when Hoosiers were asked, who do you think the number one problematic entity that is causing your healthcare costs to go up? It was not the physicians. It was not the healthcare providers. One, it was the insurance industry. Second, it was the hospital industry. So again, the state of Indiana should be heavily engaged in these negotiations, should come up with legislation and allow us and the minority to present our ideas to deal with these things. And in the future, I'll be more than happy to share with you my work on some of the symptoms. I've been working on the root causes of the problem. But until we get there, I'm working also on the symptoms of the problem, which is in the form of medical debt. That basically, when people can't afford insurance and they have to get healthcare services, they end up being in debt. So last session, I introduced legislation to deal with medical debt relief for Hoosiers across the state until we figure out how to fix our healthcare system. So again, complicated topic, and I appreciate everyone's interest in it. But my message to you, regardless of where the issue is in healthcare, what component of the system is the problem, we need citizens to speak up. This is not a Democrat issue. This is not a Republican issue. This is not a Joe Biden versus Trump issue. This is not blue versus red issue. It's hypothetical to find a human being that does not need health care. Everyone needs health care. We all bleed red, and we all need access to health care at the different stages of our lives. So I'm not here to politicize the issue. I'm here to say we can come together to solve these issues if actually we work in a bipartisan fashion. And unfortunately, currently the issue is not on our side, the Democrat side, because we're in the minority. That's why we need to elect more people to balance the political interest of the state house so that everyone can have representation.
Absolutely. Thank you. Thank you. That was some really great information and really helps break it down so that you understand that monopoly and how we have to it's multifaceted. We have to go after each one, which means we have to have good legislators in our state house so that they can have an attack plan. Please.
Yeah. I love the idea of it's like a concept, right? It's sharing the profit so that a hospital that's making a lot of money would share the money to a rural hospital because we are one state and we need to be united in the care of all the people. I think that's beautiful. And I don't know how the state could get involved because I think one of the main problems that we have is that we have what's the for-profit healthcare system privatizing everything. And I definitely would second that with the insurance companies. You just seem to read articles all the time about how they are just out to deny every claim. And then it's very frustrating for the doctors because I was earlier on a call a couple of months ago with some doctors. It was like similar to this. And they were just saying that there's so much paperwork, it gets frustrating and people don't want to stay and they don't want to be doctors. And I would have to say also that this abortion ban has caused many doctors to leave and flee the state. And that's not helping anybody because if two doctors are married and one is an OBGYN and the other is a cardiologist, so now you've lost a cardiologist. And the young people don't want to come and practice medicine in Indiana because of the same thing. A lot of doctors marry doctors, or they don't want to practice OBGYN here if they've just graduated. But yeah, I think there are some complicated things. I love the idea, though, of sharing, right? That's really what we should be talking about is figuring out, yes, you have a lot, you have more than you need, maybe. So let's bring it over here to where people don't have anything. They don't even have a hospital. I love that. Yeah, that's why I'm running for office to see if I can add to the Democratic side because there's really no balance right now with a supermajority in both houses and the governorship. And it is incredibly frustrating because the GOP doesn't have to listen to what people want at all. They don't even have to listen to the bills that people write and they don't have to do anything. So,
Yep.
Yeah.
That is what we call equity in healthcare, folks. The one hospital needs it and the other hospital doesn't. So they even each other out and then everybody's taken care of. And it would be amazing to be able to see more of that in Indiana. And hopefully we will. Right now, almost 20% of Indiana counties don't even have a hospital. Just this year, DeKalb, LaGrange, Whitley, Perry County have all experienced closures of OBGYN facilities. And we have more women giving birth now. So this seems to be a very big problem. And so before we end, we're going to just talk a little bit about that healthcare cost and the medication costs. And actually, Senator, since you have written so many good bills, so many good policies about taking care of Hoosiers and their medical needs, how do you think we can move forward as a legislature to reduce those costs in Indiana? And you don't even have to say it because I just say the constituents need to get involved. So we'll just put that out there right up front. You have to support the good legislation and you have to talk about the bad legislation.
Yeah, to be brief, I think the report that was shared in the link, and I hope you can share it later, is only one report that was produced here in the state of Indiana, which outlines the systematic issues that we're facing in healthcare in our state. If you are bored and you want to read a PhD dissertation on this, my PhD dissertation from 2018 was specifically with the question of whose interest do hospitals, nonprofit hospitals in Indiana advance? Is it their financial interest or the patient's interest? So I spent 5 years working on that question. The summary of 5 years worth of work and the summary of working as a legislator, I think healthcare is extremely important. We need any policy that I may suggest today is only good on paper unless it passes in the form of law in the state of Indiana. And I don't want to discredit also the national level because the federal government plays a critical role. It took us years and years before the Affordable Care Act was passed. And unfortunately, one of the political parties tried to repeal it over 67 times in the last couple of years. And who benefits from taking healthcare away from people? Who benefits when people die because they can't afford it and they can't get the medication that they need? Who benefits when we have our citizens struggling every single day? We lived through that for decades, documentary after documentary after documentary, and read articles after articles after articles about how people used to lose their homes every day, how people used to bankrupt and spend millions, get into millions of dollars of debt if they had cancer, if they had major issues. And it wasn't until the Affordable Care Act passed that capped the lifetime out of pocket spending and made it that mandatory and should be free for your preventative services, and said that every hospital, as part of their profit, they should come up with what we call the community benefit, which is part of their profits has to be invested in their community to improve the surrounding health. Because one point that we did not discuss today that is connected to healthcare is what we call the social determinants of health. You can be a healthy person, but if you're living in a place that is contaminated with health issues, now your housing became a problem impacting your health. Your lack of transportation to go somewhere to school or employment, that might cause stress on you, implicating or not implicating, impacting rather your health, your mental health status. If you don't have access to nutritional food on a daily basis, that becomes the problem. Employment and legal issues that you go through impact your health. Scholars across the United States from all kinds of political leanings did not dispute the impact of social determinants of health and its impact on Hoosiers and on citizens across the state. So that community benefit portion of the Affordable Care Act said you have to invest in dealing with some of these social determinants of health. You must invest in making certain things available to your consumers. What is wrong with a hospital prominently displaying, what financial aid they can offer before you get scheduled for a procedure? What is wrong with enrolling those who are below, for example, the 400% of the FPL federal poverty line into a charitable program at the hospital before you get the service and before you get the surgery and thousands of dollars of bills? What is wrong with passing legislation to prohibit collection agencies from damaging your credit report for not being able to pay? For God's sake, who benefits? I just want someone to answer the question. Who benefits when you damage someone's credit report? Who benefits? The state doesn't benefit. Other citizens don't benefit. The hospital system doesn't benefit. Matter of fact, you're crippling them, these individuals, because now they will never be able to pay. And you're putting them in some instances on the street by foreclosing on their homes and so on. So I think there is a lot of common sense legislation that we can pass immediately on a state level. But that, to conclude, we need to be engaged, elect and support those on a national level in Congress and those on a local level who care for our best interest. Again, and I promise you, I'm not saying it to promote a Democrat over a Republican or to advance. There's no good or there's no monopoly over good ideas. I will vote for and support and celebrate any Republican in the state of Indiana who's willing to sincerely and genuinely help us pass legislation to help Hoosiers, because our interest is to help citizens over politics. So I look forward to working with you and working with everybody else to be sure that we are in it for the right reasons. We're in it for public service. We're not in it for ourselves, and that we help our families with all the needs across the state.
Thank you. And what I like to say is there are people in Indiana who have voted one way their entire life, and that's just how they've done it. What I would like to say to them is it doesn't hurt to give somebody else a chance when the person in that spot has continuously voted against your best interest and offering relief for you as a Hoosier. It is okay to give somebody else a chance. And if that person does not provide relief for you as a Hoosier, then on to the next. We decide who speaks for us in our General Assembly. We hire, we fire, we the people have the power, and we have to hold them accountable. And I really appreciate all you've done in the State House for us, Senator. You've shown up time and time again and have always had the information we need to make better decisions. And I really appreciate that as a voter, as a Hoosier. And Katie and Leslie, if there's anything else that you would like to say on this topic before we head out for the evening, please. I don't want to take that time away from you.
I would just say one thing about the Affordable Care Act, because it is a very valuable, and there have been so many attempts to repeal it. But when my son was born, that was before the ACA. And our insurance company actually was going to deny him coverage because they said he had a pre-existing condition, Down syndrome. And I had to prove that I did not know he had Down syndrome, or they weren't going to insure him. So imagine how it was. I was so stressed out with this little baby with all these conditions. I didn't even know what to do. And then how are we going to pay for this? And what was I going to do? And then I was contacting the insurance company, I had to write letters and do all of this stuff. So that is one thing that people make that is lovely and that I hope nobody ever takes for granted. Denying somebody care because of a pre-existing condition is just, right, who benefits? Who benefits? And what kind of a society do we want to create? And that's why, we're here, because we want to create a better society, the society that we believe is more equitable for more people.
And I want to point out, if they were successful in repealing this and changing some of these laws, I want you guys to ask yourself what happens to women who are pregnant, who know that their children are going to have major issues after they're born, and then insurance decides, you knew before they were born, so we're not going to cover you. This woman not only didn't have access to reproductive health care to maybe make the choice to have an abortion, she then also is not going to get health coverage. And these are the realities that we're facing. If we look at the legislation that has come forward, the legislation that has been defeated, we are looking at a General Assembly, a supermajority that does not support us in health care. And that is a big deal. These are things that we could start seeing if they start taking these things apart and repealing these laws that we have worked so long to get. Katie, is there anything else that you would like to add?
Mine's a little bit more localized to where I'm at. Obviously, I'm not running it for a state office. In my county, we are currently experiencing huge crisis with our EMS service. Basically, we have used privatized companies for decades now, and all of them have failed us. And the one we are currently using is failing us huge. It is taking, in some instances, well over 45 minutes for people to receive care before the ambulance even shows up. And these are viable people that could actually have survived had they gotten the proper care. But actually, the ambulance service we have now currently doesn't even have any paramedics on staff. It's just EMTs. A lot of times they don't even have defibrillators on the ambulance. It's just a catastrophe. And I don't understand why we're still allowing this to happen. At least at the county level, we should be stepping in and making a county-wide or county-run ambulance service to make sure that our people are covered, because our taxes are paying for this. And people don't honestly know that they're not getting this service until they don't have it. They call, and then all of a sudden it takes 19 minutes for grandma and grandpa to get an ambulance to them when they're having a heart attack. That's ludicrous. And that's the biggest issue I'm seeing right here, right now. And that's something I'm very passionate about. We need to change. It's literally a matter of life and death.
And Katie, can you share with us what area that is happening in? Just in case we do have viewers that see this video who don't know and they might be in that area.
Yes, this is Clark County, Indiana, Southern Indiana. Right now, a lot of this is stemming from a lot of the scandal with our previous sheriff, who also embezzled $4.5 million of taxpayer money. And he was the one that founded and ran the New Chapel EMS. He no longer is in control of it, but a lot of the people that work for him are still there, and they're still holding down the fort and our current not heard enough public outcry.
Then you hear it here, guys. Katie just said we need the public to get involved on every level, in your local cities and towns, at the state house, at the federal level. We need you involved. You have to contact your legislators and let them know how you're thinking and feeling. And this includes in Clark County, hold them accountable. This is small local government. You can absolutely do this. I believe in Clark County. I believe in the candidates on this call. Each one of these candidates are MVPs of MADVoters. We really believe in them. We support them. We've seen what they can do, and we believe in what they can do for Hoosiers all over the state. To learn more about our MVP candidates and the 2024 election, check out MADVoters on Facebook, Twitter, Instagram, and TikTok, and at madvoters.org, where you can find our ballot buddy and see how each of these candidates score in the areas that are most important to you. I want to thank everybody so much for your time. Thank you guys for giving us an hour tonight to talk to us about these very real issues for Hoosiers. I really look forward to seeing what you guys are going to do in your communities and for our state. And I hope those who are watching this will look into each one of these amazing candidates and support them however it is you can.
Thank you.
Thank you.